Normal pressure hydrocephalus for caregivers and loved ones.
Normal pressure hydrocephalus, also known as NPH, is an abnormal buildup of cerebrospinal fluid, or CSF, in the brain's ventricles.
NPH occurs if the normal flow of cerebrospinal fluid throughout the brain and spinal cord is blocked in some way. The blockage causes the ventricles to enlarge with fluid, which then puts pressure on the brain.
This abnormal buildup of fluid leads to swelling of the brain in the cranial cavity and can become very dangerous if untreated. The extra pressure placed on the brain can lead to irreversible damage or even death.
Thankfully, NPH is treatable with the implementation of a shunt into the brain. The shunt drains the extra cerebrospinal fluid from the ventricles, which then relieves pressure on the brain. The extra cerebrospinal fluid that is drained via the shunt valve goes to the abdomen where the fluid can be absorbed.
Normal pressure hydrocephalus is mostly seen within the elderly population. This disorder can have an unknown cause, but is commonly the result from an infection, a hemorrhage, surgery complications, head trauma, or a brain tumor.
Symptoms of normal pressure hydrocephalus include progressive mental impairment and dementia, problems with walking, and impaired bladder control. The person may also present slower movements and may complain of their feet feeling stuck.
Because the symptoms of NPH are very similar to disorders such as Alzheimer's or Parkinson's disease, this disorder is often misdiagnosed. A recent study estimates that 700,000 older Americans are living with normal pressure hydrocephalus, and up to 80% of cases remain unrecognized. Research also suggests that treating hydrocephalus in the elderly population would reduce U.S. healthcare expenditures by $184 million every 5 years.
So, what can you do? Be sure to advocate for your loved one if you feel they may have NPH and are being misdiagnosed. Seek second opinions if you feel this is a possibility. Of the estimated 5.2 million individuals diagnosed with dementia, 10 to 15% are believed to actually have NPH, which is treatable with the simple implementation of a shunt valve.
Regardless of the diagnosis, continue to treat your loved one as you always have, and do your best to support them so they can continue to live a happy and comfortable lifestyle.
For more information on normal pressure hydrocephalus, visit the Hydrocephalus Association website at www.hydroassociation.org.